Employee injuries don't only just impact the employee, they impact the employee's family, they impact their coworkers, they impact the patient.
About 3 years ago, we purchased the lift equipment for the safe patient handling, but it was scattered about the hospital.
Made a huge investment, bought equipment for every unit, bought a bunch of slings, had a private company come in to do round-the-clock training. We thought, okay, we're done. And, 3 years later, it wasn't being used.
There was really no organization as to where the staff would find the slings, how they would be disposed of, and there was a lot of clutter on the units.
I think the culture at the time was it's a lot easier to just get a few staff members and just lift the patient. It's quicker and it's easier.
They recognized it, I would say, quickly and formed a multidisciplinary team of leaders within the hospital to come around the table and say, how can we address this concern that we have related to employee injuries and potential falls?
So the team itself, first off, was 50% management and 50% frontline staff. And we thought that it was really important because in order to get really successful buy-in, you really need to have some people who are using the equipment day in and day out. They came together and they discussed opportunities to improve the process.
And at the first meeting, big issues came out. One, we learned how to use this stuff 3 years ago. We don't feel comfortable anymore. We never really learned on a patient. We learned on other staff, and that's not the same as a patient, so we don't feel comfortable using it on a patient.
We decided to do something formal and put some process improvement framework behind it to address the gaps.
Looking at a Lean Six Sigma methodology is I think is crucial to running a hospital, running any healthcare organization today. There's a tremendous amount of barriers that pop up.
When you look at why people don't follow rules, if the rule's burdensome, people will find workarounds.
When we first did it, we had a lock on the door. We had to lock up the slings. You don't want anybody to steal a sling. Well, who's going to steal a sling? But that was a barrier. If they didn't have the key, they couldn't get the sling. Got rid of the lock, and now it's open 24/7, so whenever you need a sling, you can use it.
I think as soon as everybody realized that using the lift equipment would not only benefit the patients, but benefit themselves, they readily use it. There's no more trying to coach them to go find it. It's available on the units, and you can see the dramatic decreases that we've had as far as injuries.
339% increase in usage of the slings, 67% decrease in injuries where staff lost a day of work, 50% decrease in workman's comp injuries, and a 21% decrease in patients being injured during safe patient handling.
Our length of stay has dropped about 15% since we started using the devices.
This is something where we could provide a tool, a mechanism to ensure that our patients are safe, our staff are safe, and you could just see by the project itself and the outcomes of it.
I'm really proud of this project that the staff has undertaken, because this really is about the staff. And this being such a small institution, the fact that they were able to accomplish so much, I think that they should be very, very proud in what they've done.